just today, I think we have half an hour to do this discussion. We also want to involve the audience, so feel free, when we ask questions, please be brief to the point, and because we are very acutely conscious of the time, we don't want to overrun, but feel free. If there's any burning question which might help everyone, so if there is any question, keep it in your mind, and we will give you an opportunity to ask. So what I'm going to do is, we're going to start first with the panel objectives. So basically, I'm welcoming all my panel members to this elite session, and it is my honest privilege, humble privilege to introduce all of them. They're experts in their own field. Also, the objective is we're going to explore how AI is transforming image analysis, diagnostics, which I've already given a preliminary introduction in radiology, similarly in histopathology, and then radiation oncology. So please remember that this particular theme is cancer. So we are going to leave out the other conditions. So we're not going to go into the other conditions. So we're going to focus totally on cancer imaging. So if there are any questions outside cancer imaging, we can discuss that later on. So keep that in mind when you're asking any questions. And also, it is to see how there's any collaborative opportunities between the radiologists, pathologists, and radiation oncologists, whether we're already working together or whether there's more scope after implementation of AI to work together. So that's the other thing. And how are we going to integrate this into the clinical system? So the real world integration, how is it going to be done? And what are the various challenges and clinical considerations to be kept in mind? So that's the other thing which we will be briefly touching upon. And then what is AI doing at the moment in cancer? So these experts, I'm going to just take this discussion to them. They're going to give their viewpoints. And then audience, if you have any burning questions, we will ask you to jump in. Okay, so Eshwar, what do you think is the biggest challenge? So I'm going to start with Eshwar because radiology is always first. So what is the biggest challenge you think in radiology in implementation of AI on a wide scale?
I think the availability of the technology per se, and number two is the ability of radiologists to get familiar with the technology. And the third I've raised earlier too is the cost of the first implementation of the software. That is still pretty high. At the most, you're trying to use them as a demo softwares at the moment. But the cost of that implementation, and of course, the fourth is the overcalls of AI imaging as compared to. So AI is very good for sensitivity, picking up lesions, but the specificity of the disease diagnosis.
Thank you for that. So how do you think we're going to tackle this? What should be done next? We as radiologists, what should we do? What should be our contribution?
As the first speaker has said, we are sitting on a huge data set of images. I think that's unexplored. We have, as a group of our hospitals, the 4 group of hospitals, we have a huge data set of imaging, which is probably not utilized in the investigative sense to the extent possible. I think this is an eye-opener, and I think we should be data mining that data sets. And we have started very recently with the lung nodule analysis. We have started a program on MR detection of prostate cancer with AI. And of course, CAD has always been there in breast. I think that's the first one which was there, and which probably got AI into disrepute. It was showing bright spots all over the mammograms.
Sure. And the other question which I would like to ask you as a fraternity colleague is, what do you think, why are the radiologists not very happy to have AI as the first reader or the second reader, whichever you think is more appropriate? Because when AI was introduced, everyone said it's going to do the first reading and then it will be second read by a radiologist. And then now slowly, if you see, AI is slowly shifting to be the second reader, not the first reader. And I'm sure Eshwar has the answer to this secret.
I wish I had. But if you go by historically, IBM Watson predicted the death of radiologists in a decade, way back in 2008. but still the radiologist flourished.
So we won't be an
So-
extinct species.
Yeah, I think the major concern of radiologists or most, I wouldn't say healthcare, across. Yeah, you take industry, you take law, you take films. Everybody is afraid of the AI generating the codes or generating the scripts, so on. So the major concern has been the loss of jobs or reduction in, but I think we would be evolving as integrating our expertise more into clinical domains, because AI would be doing the routine stuff, the normals, the routine health checks, the routine scans. But I think we'll be more into integrating into clinical practice, guiding the clinicians and helping the patients.
Thank you, Eshwar. Well, we stay with radiology. Any questions from the audience, please, pertaining to radiology, because we have the other experts, so we'll keep the questions to that particular specialty. Anyone here? Please feel free. I'm sure a lot of you have burning questions.
One hand over there.
Yeah, please go ahead.
So my question to the panelists, it is basically related to the data what we had correlating with the real case in real time. So the model was trained giving a feedback of racist bias, because the data what we had is Indian subcontinent. The Indian physiology is different from race to race across the globe. So in that case, the model itself is showing some bias towards that direction. How India is evolving its database related to the specific radiology data or images.